All right. Thank you all so much. Oops, I forgot I have to stay on this. Thank you all so much for having us today. This was an extension of the talk that we gave, as Emma mentioned, at the ADR UK conference back in November. So I think we're just going to start by giving you a quick introduction to who we are. So my name is Elizabeth. I'm the Public Engagement, Communications and Impact Manager at ADR CNI, which is a partnership of Queen's and Ulster University. Sarah?
Yes, morning everyone. I'm Sarah McKenna, part of the team researching outcomes for care experienced children and young people with a particular focus on mental health.
So we are based within, as we mentioned, the ADR CNI, which is part of the wider ADR UK network, which within Northern Ireland comprises Queen's University, Belfast and Ulster, and then together with NISRA, we become something called ADR NI. ADR UK, which is our wider kind of partnership network, has research centres across the UK and centres in England, Scotland, Wales and Northern Ireland. We basically exist to support researchers to access linked government data, administrative data, to put together research projects that are focused on public benefit. Everything that we do is safe and secure. There's lots of protocols in place to support this. And we're really focused on addressing the most pressing societal questions in order to deliver research impact, policy impact, impact on services and things that improve people's lives. So we do a lot of work engaging with policymakers, service providers, data custodians, and voluntary community and social enterprise groups, as we would term them, or VCSE groups, which are also commonly known as third sector organizations, to ensure that as best as possible, we are responsive to policy and community needs.
Elizabeth, sorry to interrupt you. Would you be able to put in presentation mode just so we can see the slides a bit bigger? Would that be okay with you? Sorry to interrupt your flow.
No, thank you for letting me know, because I did wonder whether that was just on my screen. Apologies, folks.
There we go. That's brilliant. Thanks, Elizabeth.
No problem at all. So as I mentioned, we're going to be talking about work that we did over the last 2 years, and talking about what we would consider an approach around co-production. So there's lots of different definitions that go along with this, but the one that we really like and that we think kind of fits the way that we are thinking about it in terms of our research comes from the NIHR, and discusses co-production as an approach where researchers, practitioners, and the publics are working together, sharing power and responsibility from the very beginning to the end of a research project. And this, we think, really allows the kind of ethos of public involvement, and what we'll talk about a little bit further on in the presentation, the democratization of data to come through, and supports both people like myself, public engagement professionals, as well as researchers, to develop an approach that works for their research. So the way that we approach this is really from the basis of principles. So if we're looking at the key principles of co-production, it's things like building relationships, sharing power, being inclusive, mutual benefit, and ensuring that the work that you're doing is equitable. And the question, I suppose, that often comes up when we're talking about co-production in terms of data research is whether it's something that's even possible, right? We know that this type of approach is very well advanced in qualitative research. It's something that a lot of researchers within that sphere would do practically without thinking about it. There's lots of community involvement there. But when it comes to data-focused research, there's maybe more of a bit of a question around it because of the technical aspects of data, and the kind of safety and security protocols that I mentioned at the beginning. So we wondered, right? Are we going to be able to put in place all of these principles? Are we going to be able to remain true to these things that really have to be at the core of what we're doing? And that was the kind of questions that we came in with when we developed this work. So this is an overview of what we've done over the last 2 years with our partners VOIPIC, which Sarah is going to talk a bit more in depth about. And we're going to talk to you a bit about our experiences, both as researchers and as public engagement professionals working on this project, but we're also in a place where we have been working very closely with the young people and with our partners to understand their experiences. So we're going to be able to share some of their perspectives with you. So we're looking at this from 4 different perspectives of people involved in this work over the last 2 years. Sarah?
Yeah, thanks, Liz. So picking up on those principles of co-production, they sound great, but how do they apply in the context of data research? And as a data researcher, I want to know, how do I actually go about it? So 2 years ago, co-production was definitely new territory for the research team, and these questions were very much on our minds. But we felt it was the right thing to do. We used the young people's data, so we felt that they should have a voice and have a say in the research. And we really wanted to make sure, that our research was focused on issues that matter to the young people. So our first step was to reach out to a charity in Northern Ireland called VOIPIC, Voice of Young People in Care. And they exist to promote the rights and the voice of care experienced young people. So they were a natural partner for us. They were really interested, thankfully, in giving it a go and teaming up with the research team. So the first thing we did with VOIPIC's support was to plan and deliver a pilot workshop back in April 2022. Now, at that first workshop, we had no idea if anybody was even going to turn up. We didn't know how it was going to go, but thankfully, 7 young people came. We had a really successful event, and crucially, they wanted to do it again. Since then, it's become an established way of working with the young people. The group have given themselves a name. They're the Data Research Advisory Group, or DRAG. They've developed terms of reference. They've elected one of the young people as a chair. And we now meet every 3 months or so, and we've had about 8 workshops to date. And each of those workshops has involved an element of scoping, of capacity building, and doing some real work then with the young people on some stage of the research project. And the scoping was really us giving the young people options and saying, what do you want to work on? And then asking them, okay, what do you want to work on next? And repeat. And the capacity building piece was really then sort of sitting back and saying, okay, if the young people want to work on that, then what do they need to know, or what do they need to be able to do? And then trying to upskill them in that area. So, for example, we've done some capacity building around what even is administrative data. What does the data landscape look like? What data sets can we potentially access to do our research? We've done work around understanding research terms like what is an exposure, what's an outcome. And we've done some work around how do we actually define mental ill health? What is it? And how can we measure it in administrative data? So 2 years in, the young people have co-produced several stages of the research cycle. They have told us what's important to them. They've helped us direct the research agenda. They have worked with a team to come up with specific research questions, and they've done a piece of work defining what they think are positive outcomes for care leavers and how we can measure those. They've also been fantastically helpful in terms of interpreting results and helping the team to write those up. And they've produced a couple of easy read versions of academic outputs. At the moment, we're doing a piece of work with the young people where they are writing up this process of working with a research team. So last month we interviewed them. Next week they're going to interview us, and then we'll kind of work together and pull that into a paper so that we can share that learning. So the only stage that they haven't been involved in is the physical analysis of the data in a secure setting. So does that mean then that we haven't done co-production based on that original definition that Liz shared? Well, I think it depends on whether you take a purist or a pragmatic stance. Certainly my opinion on it is that I think those principles of co-production can stand alone within each stage of the research process. And I also think we need to be wary of imposing an academic stance. For example, we asked the young people, is that analysis stage something that you want to be involved in? Do you feel like you've been excluded from that within the work that we have done? And with one exception, they all said no. we're happy for you. We're happy to lead you on researching what's important, set the agenda, set the questions, help you interpret it. But the actual analysis bit, we're happy to leave to you. I'd be really interested to hear your thoughts on that during the discussion. And something else that's evolved from this work has been a paid internship. So this was conceived as an opportunity for one of the young people just to become more embedded and work more closely with the research team. We were lucky enough to secure some funding from part of Queen's called the Widening Participation Unit. Their remit broadly is to support young people with care experience into university and then support them through the university experience. But they felt that this aligned broadly enough with their overall ambition of improving opportunities for care experience young people. So they provided the funding. And this is Rihanna. This is a photograph of Rihanna. Rihanna was the intern for 8 weeks last summer. She made a fantastic success of the opportunity, and it was deemed a success all round, and is something that we're committed to delivering again, and we are currently recruiting for 2024. And I also just want to share with you a photograph on the next slide, Liz. So this is a photograph of some of our data research advisors. On the left there is the Children's Commissioner for Northern Ireland, Chris, who presented them with their award. And this was an award they received for their contribution to research at the National Care Day Awards earlier this year. So just thought it'd be really nice to share their achievement with everybody on a call. So through delivering all of this work over the last 2 years, that partnership with VOIPIC has been really essential, particularly in the context of this research and with this particular group. I actually don't think that it would have worked without them. So it was VOIPIC staff that had that network of contacts with young people with experience of care. They had already built a relationship with the young people, and they encouraged the young people to get involved. So initially, at the start of this process, we developed a flyer. We thought it was really young person friendly and looked really good. VOIPIC staff kindly circulated it around their networks, and we had 0 takers. Nobody was interested. And in the end, it was VOIPIC staff that persuaded the young people to come along by saying, look, trust us, we'll go together, come with us as part of VOIPIC. You're not going on your own. And if you don't like it, we won't go back. So it was VOIPIC really that enabled the brokerage of that relationship in the first instance. They have also been a constant guide to the research team. Before any session with the young people, we sit down with VOIPIC staff, we talk about the aim of the workshop, we plan the content, we plan the structure, and VOIPIC have been incredibly helpful in terms of making sure that that's all appropriate and accessible. But also when we're live in a session with the young people, VOIPIC staff have been really helpful extra facilitators, helping to ensure that the young people can engage and contribute and participate. But I think most importantly, in terms of VOIPIC's role, they've been able to support the young people in a way and look after their well-being in a way that us as researchers just wouldn't be equipped to do. So we deliver a workshop, we pack up our kit and our flip charts, and we can go home. But the workshops we're talking about really difficult subjects at times, like self-harm, suicide ideation, mental ill health. And it was VOIPIC staff that were available at the end of a phone after the workshop to give one-to-one out-of-hours support to anybody that needed it for as long as they needed it. And interestingly, we asked the young people recently, would you have got involved and would you have stayed involved without VOIPIC support? And they all said no. So for us, it's been really essential to have that partner organisation that knows the young people and can provide that support. So has it all been worth it? Well, we'll share an opinion on that from different perspectives, starting with ours, the researcher perspective. There's been, I think, numerous benefits so far. It has changed the way that we think about and do our research. For example, one of the key messages from the young people has been focus on the positive. I think as researchers, we are inclined to go for the headline grabbing bad news when we're trying to get our research story out there. But if we say a third of care experienced young people experience mental ill health, the young people flip it and say, well, 2/3 don't. And that really subtle but important shift in perspective has influenced the way that we write up our work, and it's shifted our focus of the whole sort of next wave of the programme to look at predictors of positive outcomes for care leavers. I think it's led our research in directions that it wouldn't necessarily have gone in without the young people's input. For example, one of their key concerns has been around that period of aging out of care. What happens to young people when they leave care at 18? So we've done some work around that and looked at risk of self-harm and suicide during that transition period, and we'll do the same with other data sets and other outcomes, including homelessness. Our research is reaching a wider audience than it would have done previously. For example, we promoted one of our academic papers on social media when it was published. It had a modest level of interest, shall we say. But when we promoted the young person's version of the same paper, the metrics massively outstripped the academic one. And things as part of that paper that the young people developed, infographics and so on, little visual stories that the researchers' findings are trying to tell, they're much easier to share widely, understand and be accessible to a wider audience. And I think just on a very personal note, and I'm sure I speak for the rest of the team and everyone else that's been involved, it's actually been really rewarding, really enjoyable. It's been a privilege to work with the young people. They challenge us, they call us out on our research if they think it's not good enough. They make us laugh, and it really, really helps you see the point as a data researcher of the work that you're doing. If I've made that all sound rosy and lovely and very straightforward, of course it hasn't been. There have been challenges along the way. I think the obvious and universal one is that it takes time and it takes resources. I don't expect anybody on this call is sitting there thinking, I have so much time in my diary. What could I possibly fill it with? Let's do some co-production. Of course, everybody's under pressure. Everybody's workload is intense already. And there's no easy answer to that, but it's an important consideration at the planning stage to make sure that the time and resources are there to adequately support this work. There's been considerations around membership. How many lived experience experts is enough? I don't know. We started with 7 data research advisors. 3 of that original cohort drifted away over time, not just from this work, but from VOIPIC, as tends to happen. The young people can come and go. So we've had a core group of 4 young people. They've been at every workshop and they've been fantastically committed throughout. In our wisdom, we decided towards the back end of last year to do a recruitment drive and refresh the numbers. With hindsight, it was a bad idea because the young people got involved and they came up with a brilliant new flyer and they acted as advocates, and we managed to get 4 new young people interested. But then we were in a situation at the next workshop where we had these completely different playing fields between the old cohort and the new cohort. There was differences in terms of group dynamics, the level of understanding, the relationships that the young people had with the research team, and of course with each other. I think on reflection, a recommended or preferable approach would be to recruit for a finite period of time, say for 2 years, whatever works in the context of your work, and have those young people for a period of time and then start over with a new cohort and do all of that relationship building and capacity building work again. Again, really interested to hear other people's comments and views around that. And I think there's been a big piece around managing expectations. The young people have asked us to research things that are just not feasible to do. We don't have the data for it. You know, it would be more qualitative work, for example. But the young people have been absolutely fine when we've just been upfront and honest about that and said, it's not possible to do that. But of all these things that we can do that you're interested in, what's the priorities there? And that's been absolutely fine. The other thing is that research is slow. Data research, particularly, certainly we find in Northern Ireland, can be slow in terms of accessing data, getting data access agreements in place. And we have yet to start work on some of those research priorities that young people identified because of delays around that. So it's definitely been a crash course for the young people in learning just how frustrating data research can be. So what about VOIPIC then, our partners in this process? Well, VOIPIC staff tell us that the number one benefit from their perspective has been supporting the young people to be heard. That's why they exist as an organisation. They exist to amplify the voice of care experienced young people. So there's a really good alignment there with their organisational aim. It's also given them access to research, which supports their wider advocacy and policy agenda. And they've also fed back that this work and having this as a case study, if you like, has been really beneficial for them when applying for other funding to provide an example of the kind of work that they do supporting young people to be heard. There is, of course, the universal challenge of resources and capacity. It's as relevant for VOIPIC as it is for research organisations. Like many organisations, VOIPIC have been subject to really savage funding cuts and financial pressures, particularly in the last year, 18 months. Now, fortunately for us, VOIPIC have prioritised this work because they see the benefits. And last year they were able to leverage some money to support the partnership through a pot of money called an Impact Accelerator account, which some of you may have heard of. And I see that as a really important shift that's needed in the research environment, that there is funding to support partnerships as well as projects. So what about the young people themselves then? What have they got out of it? Well, they do feel like they're shaping our research. They do feel like they're being listened to. At one of the earlier workshops, one of the young people randomly asked us, why are you doing this work? Why are you interested in care experience and mental health? And we sort of gave our answers about what motivates us to be involved in this area of research. And then we turned it on them and said, well, why are you doing this? Why are you being a data research advisor? And one of them said, well, I just don't want things to be the same for my wee sister. And I think it's been really striking just how the young people are motivated by trying to make a difference for the young people coming up through the system behind them. They have learned a whole raft of new skills and gained new knowledge. And I think that having tangible outputs like a paper that they're named on as author and receiving an award are really great achievements that are great for their CVs and as well their sort of sense of achievement. And when we interviewed the young people, they all commented on how much their confidence has grown, how proud they are of the work that they've done. And I think really importantly, that they no longer see academics, researchers as something superior and inaccessible and beyond their reach. They all commented that they feel equal and that they have been equal partners in the process. Challenges that the young people reflected on, well, level of understanding and pace. They fed back that some of the things that we've covered in workshops have been complicated and took a while to grasp, and that actually they would have preferred to do some more intensive capacity building work earlier on in the process and to have had that less spaced out in terms of intervals and done that closer together. Participation, the young people commented that they didn't always feel confident to speak, certainly in the earlier stages of the relationship. We were always really mindful to try and have techniques and tools within the workshops that were not just open discussion or putting people on the spot and feeling like they had to talk in front of a group. And we used all manner of things like group work and people writing individually on post-it notes and using traffic light assessments and stickers, etc. But they still commented that the confidence was an issue for them. But they also reflected that actually, no matter how those workshops have been structured and what tools and techniques were employed, that would have been the case. And the solution to that was time. They just needed time to get to know us, to build that trust, and can't shut them up now, quite frankly. But I think that's the lesson for us, is that don't expect too much too soon. And of course, on a more sober note, the workshops were triggering for some in terms of the content. It was hard going, but the young people were part of the decision-making process. They decided to cover those topics with us. They knew that they could opt out of attendance completely. They knew that they could take a break or ask for support during a workshop, and that they had the support of VOIPIC staff before, during and after any time they were working with the team. And Liz, I'm going to hand back to you to share the ADRC and I perspective.
Thanks, Sarah. So from an engagement professional point of view, from the point of view of the wider team, I suppose, that was kind of supporting this as well. I personally was incredibly excited to get this up off the ground and running. It's something that had been kind of percolating in the back of my mind through the development and the evolution of how we were approaching engagement and involvement at ADRC&I. And I think that, as I mentioned at the top of it, for me, it really comes from this focus on how do we widen access to data, not just for researchers, but how do we create research projects and engagement programs that will allow the people whose lives make up these data sets to be involved in the way that the data is used as much as possible at every step of the way. So I'm kind of starting from the bottom up there, but I think this is a really clear-cut way, or really demonstrates a pathway towards that. Democratization of data and widening that access for people. I think that as well, that when you start to have conversations with people, whether it's experts by experience or the community groups like VOIPIC that work directly with them, and they talk about the kinds of issues that are facing their communities or the things that they would like to see change or would like to understand better in order to advocate for themselves with decision makers, there is a real desire for data to be used. I think a lot of the conversations that we have around data as public engagement professionals and as researchers is still asking this question: how do people feel about this? Do they want us to do this? And we should continually ask those questions. I'm certainly not suggesting that we just kind of shut off and go, okay, this is fine, we can go do whatever we want. But I think it's also important to do what the young people have asked us to do, which is flip that in a more positive way. And look at it from the perspective of, no, this is a positive thing. There is a desire for the data to be used. And that, for me, has really been demonstrated through our work, our close working relationship with VOIPIC and with the young people, because the fact that they are able to get closer to the research and get closer to the data and understand how it's developed and understand how it can be used, there's much more support for it being used in that way. I think this also, for me, demonstrates that we need co-production within data research. We mentioned at the top of the presentation that it's something that people often shy away from within data research. We referred to the different stages within the research process and the kind of hesitancy around suggesting that we could even do co-production or that it's necessary when there's a big kind of chunk in there that more than likely at this point in time anyway isn't going to be possible to get people directly involved in. But from my perspective anyway, this project really demonstrates that we can do co-production within data research. And not only that, it's needed. It gives all of those different perspectives that Sarah was talking about, all of those different benefits to the researchers, to the young people, to the organization. And for me as an engagement professional, it helps me better understand how to continue to evolve this process and how to design things that can bring in more and more groups, which actually kind of brings us on to the challenges. Obviously, universal, as Sarah said, time and resources. We have a very small engagement team at ADR-CNI, which is me and one other staff member that are focused specifically on engagement. We have a wider professional services team as well, which are key in making all of this happen. But we are also, as researchers are as well, involved in lots of different types of work and lots of different projects. So that can be quite challenging, because as each research project or each engagement program that goes along with a research project requires a lot of time and resources. A lot of that is then needing dedicated support from an engagement professional and an engagement team. And that can be really challenging to be able to give the same level of support and involvement to all of your researchers. And to be honest, I think at this point anyway, it isn't possible for us just yet. And part of that problem, from my perspective, is that funders are requiring that this work be done, but it's not being resourced yet. It's not being resourced yet to the level that it needs to be for people to properly support and resource these projects so that researchers can engage in a meaningful way, so that it's not tokenistic, so that they can spend the time on relationship building, which is so key. So I think, unfortunately, we are in this kind of point where we have to try to do this to the best of our ability in order to evidence that we need more resources. But we'll talk a little bit about evaluation and why that's important later on. But I think that that's a really key thing to highlight, is that sometimes, particularly when it comes to engagement and participatory practices, you have to show people, yes, this is possible, but it's also not possible to go any further than this until you give us more resources. I think the skills mix then is also very challenging. Obviously, most researchers wouldn't come to this type of work having had experience in it, and it does take a different sort of skill set than pure research would. And getting that balance with your research team can be a little bit challenging. It's not something I think that, and Sarah and I have talked about this quite a bit, but it's not something that somebody with an engagement background, like someone like myself, can just take the research and go and deliver your workshops for you. Really doesn't work. I like to say all the time that working closely with researchers means I know a little bit about a lot of different stuff, but you scratch too far beneath that surface, and my knowledge about the data and my knowledge about the research, it just runs out. So we need both of those people in the room. We need all of those skills involved, and that can be quite challenging to try to figure out how to do that within the available time and resources. You obviously have to get buy-in, and that's across the board. You have to get buy-in from your researchers that they're up for this, that they're up for the challenge of doing it and trying something different. Even I suppose before that, you have to get buy-in from your institutions and your leadership, your research directors, people like that, because they're the ones that are going to nudge your researchers and say, no, you're going to need to listen. You're going to need to go and try this with her, and we're going to support you to do that. But this is important. Otherwise, you're not going to be given the space to work with researchers and try to figure out how do we do this together. And then, of course, you also need your buy-in from your third sector partners, from your young people, or whichever community you're working with. And so there's a lot of convincing, I think, that goes on with this type of work. And that can be challenging, kind of making that case and ensuring that you have the evidence to back up what you're saying. And then alongside of that is really the challenge of rolling this out across a number of different research projects. So we've done this, we feel, fairly successfully with FOIPIC. And now we're looking at how do we take this approach and adapt it for another type of research or another topic. So we're looking at a research program that we have around homelessness. And we're actually in conversations right now with a community group around how we could kind of adapt to this and start to rerun this work on a different research program. And that is inherently full of challenges because it's a different topic area, it's a different community group, they're different researchers. And so we have to kind of run through all of these challenges again. So I mentioned impact and how we evaluate this. So this is really important because while I think particularly from an engagement professional point of view, we often look at involvement as a right that people have. This is just something that we should be doing. And by doing it, you are fulfilling the need for it. And that's enough, right? And I do think that is at least partially true. But as I mentioned, we do still need to be able to develop the evidence to demonstrate or justify that this is worth doing so that we can continue to get the resources to do it, and to expand it, and scale up the work, as well as understand what works and what doesn't. We can have a piece of involvement as part of a research program, but unless you're actually looking at how that worked, what came out of it, you don't know if that's the best way. And with our kind of process of rolling this out across other research projects, that's kind of one of the things that we're testing. We've been, as you can see on the screen there, we've been evaluating this project as we go along, using different reflective practices, ensuring that we're doing evaluations with the young people after each workshop. Sarah mentioned the metrics for the young people's publications and how much they outstrip our own, and speaking to them for things like case studies and testimonials, to help us understand whether this is the right approach. And if not, what do we need to change, and how can we reflect on what we're doing and change it for the next project, as well as evidence to the funders. This is something that's worth doing. This is how we did it before. This is where the challenge is. We're going to need X amount of resources in order to change that for the better, for the people with whom we're working. So to circle back to our question, I suppose at the top of the presentation, can we do co-production within data research? Is it worth it? Should you try it? I think you'll find that both Sarah and I come down very firmly on the side of yes. Yes, you should do it. Yes, it's worth it. Yes, it's possible. Building relationships, absolutely critical. Sarah mentioned we would not be able to do this without VOIPIC, and for all of the reasons that she listed. And I think the main kind of takeaway for me with that is that it really runs the risk of being tokenistic and disingenuous, and dare I say harmful, if you're not working with a support organization, because there will be things that come up within these workshops that we as academics, as researchers, are not equipped to support people with, and that's not our job. But we need to be mindful of that. And alongside that, I think, is the aspect of sharing power. It is understanding that our type of knowledge is not the only one. It's not the most important one. It's simply a way of knowing. And people with lived experience have another way of knowing, and the people who work with them have another way of knowing. And all of those things need to come together in order to successfully deliver work like this. As well as all of those things together then really brings us on to the fact that we can sit here and talk to you about what we did and how well it worked. But in order to be properly inclusive, you need to have a bespoke approach. You need to be working very closely with your partners and with your communities to ensure that you are addressing their needs and their concerns. We know it needs to be of mutual benefit. We've gone through what we have discovered and what we've been told is the benefit for our partners. Obviously, we've talked about how it's benefited us, but it's really key that that is a two-way relationship, and that any relationships that you're creating and any projects that you're doing are equitable. But yes, we would say absolutely we can, we should, we must be working towards an approach of co-production, particularly with historically excluded groups. So it's kind of our final takeaway. We would suggest work with a partner you really know that can support your lived experience at networks. Take those principle-based approaches. You may have others. Would love to hear, any experiences that you've had or anything that comes out for you that you think we haven't mentioned here. I think that these are not exhaustive and are and should be continually evolving as we do this work. And actively reach out to those communities, work with them to develop the approach that works best for them and for you. And finally, to leave you with a quote from one of our data research advisors, it's the best thing I've done, which really kind of sums up, I think, for all of us, why we continue to do and champion this work. Just very quickly there to acknowledge our partners in VOIPIC, as well as the rest of our team in ADRCNI. Thank you very much. That's where you can contact Sarah and I if you have any further questions.